My name is Narith. I'm going to show you the diabetes patient monitoring system. This system has three users: the administrator, the doctor, and patients. We use the case study on Barra Regional Referral Hospital Diabetes Clinic. Apparently, let me log in as a doctor to see activities performed by the doctor. Yeah. When a doctor logs in, this is a dashboard on which is taken. A doctor is in a position to view patients available within the system. You can view today's appointments, the number of today's appointments, the number of flagged patients, the patients whose glucose levels are out of range, and the number of monitoring blood glucose patients. Here we are displaying a list of today's appointments. So you can see here, you can record more readings or view details of a particular patient. We also added here some filters so that if at all a list is long, one is in a position to filter. We also have missed appointments, whereby the doctor is in position to see those patients that never met their doctors on specific days. For instance, for missed appointments, we can clear the appointment, we can view details of a particular patient, or even send a patient an SMS. We have also provided graphs showing for pending appointments. These graphs here show the number of people that are supposed to come on particular days. For instance, on the 18th, we expect one patient. On 26th, patients so the expected are 5. This enables doctors prepare enough resources for patients. And for missed appointments, these were patients that were supposed to meet their doctors on such particular days. So that's how we have summarized the dashboard of the doctor. On the side nav here, we have schedules. On schedules, we have today's appointments. We have pending appointments, missed appointments. Here we are displaying the list. Then when it comes to patients, here we can record the readings of a particular patient. Similarly, if at all you click here, let's record readings say of you can enter the number of particular patient whose readings you want to take. 006, that patient, he hasn't taken today's readings yet. We can add his weight, for instance 76. We can add glucose after checking whether eaten or not, the same 7.1, save. We can also add his blood pressure, say is 78. Also save. We can also set the appointment date of this particular patient, the date on which is supposed to come back. So that's how we add readings on a particular patient. When we go back to our dashboard, we can also on our dashboard we can also view details of a particular patient. For instance, let's view details of Narith. This is the patient number 03. He has not yet taken. This is the profile. The data about him, suffering from type 1 diabetes, then hypertension status is hypertensive. For today's results, he has not yet taken readings like how we did it with the other patients. We haven't already taken patient readings of such patient. When you go to previous visits, these are the last meetings that he has been taking his glucose levels. For instance, the latest reading is plotted here. We are plotting glucose readings on the graph here. So these are the readings and their corresponding graph. Then when we read the blood pressure, we shall read these readings here plotted on the graph and the corresponding days on which they were taken, the corresponding dates. The same applies to weight. whereby these readings, still these previous readings, will be loaded on the graph as shown here. The doctor is also in position to see the overall all patients registers within the system, and for all patients that are registered, the doctor is in a position to view their details, can also edit, can print. There's a button, on clicking this button prompts the doctor to print a list these names of patients, or can also enable him save it as a PDF document as shown here. So this is the PDF document of the registered patients in the system. The doctor can also decide to export the patients in a CSV file, as also shown here. These were the patients exported in Microsoft Excel. Continue, then we can go to the mobile application. For this is designed for the patients to enter glucose levels that are seen by the doctor, so that the recommendations are given back to patients. Cancelo, this is the application we have designed. Now can enter username, distance cards, maybe password, and you can log in. On logging in here, we see my doctor. The patient is able to interact with the doctor, medications that the medicines the patient is supposed to take, the glucose. The patient here is already can see graphs for the corresponding readings. Can also see appointments, patient. Then you can see comments from the doctors regarding on how you can use medicine and the rest. You can also add reading. For instance, go to add reading. Here we shall say the latest readings, where these are the latest readings taken by the patient, and therefore you can add a new reading here. For instance, we can select whether eaten or not. This patient is fasting, he hasn't yet eaten. Then reading can put around 6.7. Then you can put some comments. I am now okay. I'm now okay. So we can save this reading. And saving this reading, we shall find these readings in the database. The doctor can easily view such readings. For instance, if we go to patients and then SMBG patients, we can view details of this particular patient. This is the patient under the self-monitoring blood glucose, but we are more interested in the readings that have been taken. For example, these readings are on their corresponding graph as shown here. So that's all what we had for you. Thanks for watching. Subscribe to my channel for more videos.